What are your concerns about if the court sustains the Fifth Circuit in terms of the ability of the federal government or anybody else to limit gun accessibility from people who have domestic violence orders?
So there's two sides to this. One is the personal. I've taken care of multiple victims of domestic violence shootings, and they are, like those firearm suicides, just horrifying. They almost never come out of the blue. Folks know before they happen that they are at risk. I lost a colleague, a fellow emergency physician in 2018, who was shot and killed as she walked out of a shift at a Chicago hospital by her ex-fiance. So this is something that has tremendous personal resonance to me. The other side of it is that domestic violence is one of those very well-established risk factors for violence against self and others. Again, not just against the partner, but also against children, family members, and society at large. And so there is tremendous concern on the part of the health and public health community that should that Rahimi case be decided to overturn the prohibitions on firearm ownership by folks with a history of conviction of domestic violence, that it will have tremendous negative downstream effects for Americans in general in terms of the number and severity of firearm injuries.
And you are referring to the Romina case, which is before the Supreme Court. Thank you for making the connection between domestic violence situations and gun violence. But the Bruen decision is leading to unexpected consequences, I would say, and in many criminal proceedings, the criminals or the people who are being tried are using the Bruen decision for the proposition that they cannot be prevented from owning a gun. So the Bruen decision is going to continue to create a lot of questions. In fact, in Hawaii, for example, we have some of the strictest gun laws, and many of these laws are being challenged under the Bruen decision. So I think that the Bruen decision is one that I think Congress should look at. I realize that that decision is based on a constitutional right to bear arms, but it is not an unfettered right, and I think that there is probably more that we can do to limit the impact of the Bruen decision. Thank you, Mr. Chairman.
Thank you, Senator Hirono. Senator Kennedy.
Thank you, Mr. Chairman. Dr. Rainey, welcome first. You are an ER doc, is that right? Okay.
Correct.
And understand you've been on television a lot?
A fair amount.
Yes, ma'am. And I understand you built a home television studio, is that right?
That's a bit of an exaggeration. I had a laptop on a stool.
Your husband didn't build you a home studio?
He did not build me a home studio, no.
Okay. Let me ask you this. Why do you think that Chicago has become America's largest outdoor shooting range? Do you think it's because of Chicago citizens who have no criminal record, but who have lawfully a gun in their home for protection or perhaps for hunting? Or do you think it's because of a finite group of criminals who have rap sheets as long as King Kong's arm?
So Mississippi, Louisiana, and Missouri actually have higher firearm death rates. Obviously, there's certain...
What about Chicago?
So I don't live in Chicago. It's not my primary area of research.
You don't have an opinion on that?
I think there's easy access to firearms combined with environmental conditions, lack of great education. There have actually been studies showing that when you green vacant lots and repair abandoned buildings in urban neighborhoods, you see decreases in gunshots, in violence, as well as in stress and depression in the neighborhoods around them.
No disrespect, Doc, but that sounds a lot like word salad to me. Let me ask you this. In September of this year, our New Mexico governor issued a public health emergency order, and she suspended the right to bear arms in Albuquerque and the surrounding county. Do you support that?
I do not. What I do support is the work that New Mexico
Yeah,
has
but
done
do you
with.
support that?
No.
You don't? Okay. Let's see. During his first 2 years as the DA in Philadelphia, District Attorney Krasner and Loster dropped 47% of all the illegal firearms cases in the city. Do you agree with that?
I'm not a lawyer. I'm a physician and a public health professional. I can say that New Mexico has done amazing work in trying to address the suicide and partner violence.
I'm asking about Philadelphia.
I don't have an
The DA
opinion.
dropped 47% of all the illegal firearms cases. Did he do the right thing there?
I don't have an opinion. However, I will say that just as with fentanyl, the spread of illicit
I'm
substances.
sorry to cut you off, but I'm
That's
running
okay.
out of time.
Understood.
The LA District Attorney, George Gascon, said that he would not prosecute any sentencing enhancements for guns or gang-related activity. Do you think he did the right thing?
Again, I am neither a lawyer nor a prosecutor.
You don't have an opinion on that?
I honestly don't know enough about it to have an opinion.
You don't think gangs should be prosecuted for having illegal guns?
I'm neither a lawyer nor a prosecutor, and that's not my area of research.
But yet you want to take guns away
I've never said that I want to take guns
from
away.
law-abiding citizens.
I think that you are saying something that I've not said in my written or oral testimony, sir.
Okay. You equated gun deaths to heart disease in your opening statement.
Yes, sir.
Which is a greater public health problem, gun deaths or heart disease?
So heart disease does kill more folks across the United States, largely in the
About
end of their life.
700,000? Mm-hmm. Yeah. Gun deaths about 50,000?
Correct.
Do you support outlawing fried foods?
I'm sorry. How does that relate to?
Because fried foods contribute to heart disease, don't they?
Again, I have not written or said that I support
You're a
outlawing.
physician, right?
I am. Have I said that I support outlawing anything in my testimony today?
Okay. Let me ask one more question. I'm sorry, I cannot see that far, Doctor, on the very end.
Cozy Gay, thank you.
Yes, sir. You said, I wrote it down, you said that no one should be judged by the worst thing they have done in their lives.
Correct.
If one of these young doctors sitting behind you, God forbid, walks out on the streets of Washington, D.C., and is raped or sodomized, you don't think the rapist should be judged?
I don't think it should be terminal. It shouldn't be for the rest of their lives.
You think we should forgive them and not give them any punishment?
I believe in
You think
forgiveness.
nobody's responsible for their actions?
I believe in responsibility. I believe in forgiveness.
Thank you, Mr. Wow. Thank you, Mr. Chairman.
Thank you, Senator Kennedy. Senator Butler.
Thank you, Chair Durbin, Ranking Member Cornyn, for convening the committee on such an incredibly important topic. I want to also appreciate our witnesses for joining us today, offering such incredible testimony. Most importantly, Mr. Chair, I'd like to appreciate the physicians and clinicians who've joined us today for their dedication in helping us to protect our members of our community and also for your dedication in helping our country combat this important crisis. Mr. Chair, I agree with the words that you offered. This is a conversation that is about our children. It's a conversation that, in my opinion, is very much about the future of our democracy. Dr. Rainey, I'd like to direct my first question to you. For decades, Congress has refused to allow CDC to use federal dollars to research gun violence prevention. Finally, in December 2019, Congress passed the Gun Violence Prevention Research Act, which granted $25 million per year to the CDC and the National Institute on Health to study gun violence prevention from 2020 to 2022. For those who feel like they know everything and that we keep having the same conversation, Dr. Rainey, can you tell us what this money has been used to help us learn, and what more do we still have to understand relative to gun violence prevention?
So that money is currently being used to study things such as projects working with the National Guard to try to decrease firearm suicide through lethal means counseling, projects working with families to improve safe storage of firearms when someone has dementia to reduce the chance of intentional or unintentional injury or death. It's being used for projects to describe risk factors, to evaluate programs like the one that I mentioned around putting gardens in vacant lots, which has shown to decrease gun violence in surrounding neighborhoods, to see can we expand that work. There are projects that are being, I mean, I could go on. It's a whole bunch of things like that where we try to identify what are the patterns of injury, how do we identify risk and protective factors, and then how do we intervene, again, in the same way that we intervene for heart disease. Maybe there are medications, maybe there are counseling efforts like teaching people about obesity or smoking, and then potentially there may be legislation, but legislation alone is never sufficient.
Thank you. Mr. Vaughn Bryant, I'd love to now turn my next question to you. In a related topic brought by Senator Hirono, gun violence really does sit at the intersection of another public health crisis, that being intimate partner violence. In the United States, approximately 1 in 5 women and 1 in 7 men have experienced severe physical violence by an intimate partner. On average, 3 women in this country are killed each day by a current or former intimate partner. When an abusive intimate partner has access to a firearm, that victim is 5 times more likely to be killed, as has been noted. My question to you is based on your community violence approach, prevention approach. Have you seen what has been the impact of your particular approach, the approach that your organization offers as it relates to intimate partner violence?
So we would say that interpersonal conflict in general is one of the precepts to gun violence, and oftentimes is either intimate partner violence or conflict between intimate partners in general often leads to a larger conflict, which also leads to death. So for us, we have partnered with local domestic violence organizations to learn more about intimate partner violence. All of our clinicians are trained in domestic violence as well, so that they're understanding of that as they work with the people that we're really trying to seek. And we will on an ongoing basis continue to strengthen that relationship so that we're aware, but that we're also teaching our domestic partner partners, domestic violence partners, about our work so that we can continue to strengthen what we know is a precipitant to gun violence.
Thank you. Thank you, Mr. Chair.
Thank you very much, Senator Blackburn.
Thank you, Mr. Chairman, and I want to say thank you to each of you for being here today, for your thoughtful answers. And I think, Mr. Chairman, we can all say we want to make certain that children are safe when they go to school. And I want to start with that. Ms. Ware, let me come to you. I'm a mom. I'm a grandmom. I've spent so much of my work on making certain that we protect children and that they have an environment where they can learn, whether they're at school or in community activities. And I think we all know that there are violent criminals that are in our communities, and we know that our schools need training, and they need security tools to keep children safe. And that's why I introduced the Safe School Act. This is a concept I've worked on for years. It would be a $900 million grant program that would allow schools to harden and to have the technology that they need to keep children safe and to increase their physical security. And it would also allow schools to work with local law enforcement and train and hire former police officers to work as school security officers. So I'd like for you to talk for just a moment about the immediate need that we have to make certain that children are safe at school.
Sure. Well, thank you for your question, Senator. First, I think it's important to acknowledge that statistically speaking, our schools are actually pretty safe places for children. It's not, statistically speaking, where they are most likely to be shot. It's outside of school. That said, there's still a lot of work we can do. No child should have to go to school. No parent should have to send their child to school asking that question, is my child going to come home today? And that's a very real fear, even if statistically not the biggest part of the problem. And so by securing our schools, that's essentially what we're trying to do. This is not some unique thought. This is what we just walked into, all of us today, into this building with basic measures of security. We know that in terms of mass public shootings at schools, for example, the time that it takes for armed confrontation, the good guy with the gun to get there, that is the difference between life and death for a lot of people. We saw that.
Okay, let's talk a little bit about those mass shooters, because we know that 25% of the mass shooters have been diagnosed with a mental health disorder. And we know 55% of American adults with mental illness have never sought treatment and never received any treatment. And we also know that 42% of mass shooters experienced physical abuse, sexual abuse, parental suicide, or severe bullying as children. And Tennessee has a phenomenally successful program to address and alleviate childhood trauma that serves as a model for the nation. And Senator Shaheen and I have introduced a bill that would make those services available nationwide, and the dollars to fund that. Dr. Rainey, it speaks a little bit to your work. But Ms. Schwer, if you will talk for a moment about the importance of addressing mental illness, I would appreciate that. And Mr. Cook, I'm going to come to you for the wrap-up after her comment.
Addressing untreated mental illness in particular, including early intervention, getting people treatment before it becomes a crisis. This is important not just for suicide or for mass public shootings, so it certainly is important there. It's important for human flourishing. It's important even far beyond the scope of firearms. Again, we're talking about roughly half of suicides being with something other than a firearm. And so to the extent that we can get people in crisis help, especially lethal means counseling about all lethal means, not just firearms, that saves lives. And it also, again, promotes human flourishing. It promotes better communities and healthier families, and that is important on a grand scale.
Thank you. Mr. Cook, and welcome. Glad to see my fellow Tennessean here today.
Pleased to be here. Thank you for having me.
Sure. I'd like your response on the intervention and the mental health component of mass shootings and suicides.
Well, if I could also touch on the school issue that you raised, because part of the Project Safe Neighborhoods program that we had, and it was so successful in Knoxville, included interfacing with, as you may know, we had school resource officers, and that was attacked nationally as part of the Defund the Police. It was an incredibly important program as part of our comprehensive approach to reduce violent gun crime, because those individuals brought a very positive influence into the schools. They made a good impression on the children of all ages, mostly high schoolers, in connection with our program, and proved to be a critical component in educating them on the need to avoid gun violence and the resources that are available to them in the community to avoid getting drawn into gang violence.
Right, I appreciate that. My time has expired. Thank you, Mr. Chairman.
Thank you, Senator Blackburn. I'm going to take a moment here, a prerogative as chair of the committee, in light of testimony and questions earlier, to note that the two of the three majority witnesses are from Chicago, which I'm honored to represent. I thank them for being here. And to also note that it is not unusual for my colleagues on the other side of the table to talk in negative terms about that city. I'm honored to represent it. It has many challenges, as most American cities do, and I'm going to work to make things better. But a question was asked of Dr. Rani about Chicago, which she answered, and then proceeded with a question from the senator from Louisiana to talk about other areas facing challenges of gun violence that show that they're struggling even more than Chicago. I'd like to give you an opportunity to complete that answer.
Thank you. I think I was talking about Louisiana, New Mexico, Utah, other states with quite high rates of gun deaths, and talking about the beautiful collaborations between community members, law enforcement, and the legislature in those states to both set up great data tracking and then to work with community groups to put in place programs to decrease gun deaths, both in the cities and in rural areas.
Thank you for that. And I would say that any member of this panel who is naive enough to believe that his state, her state, will never be touched by gun violence should consider what's happened just recently in the state of Maine, where the whole population of the state was asked to stand down. No one would have chosen Maine as the next target for gun violence, but the fact is, with 400 million guns in this country, every state, every city, every locality has that threat facing them. Senator Booker.